This talk hit me like a brick wall. I will explain why. Hi, my name is Daniel Avasar. I've been doing this Building Brain Awareness talk series for a few years now, and I'm a brain injury survivor, and the goal of these talks is to get at the nature of brain injury problems to help people sort of better understand what we're dealing with. This talk is on circadian rhythm misalignment. It is part two of two talks that Dr. Jerrod Brown agreed to do that are on sleep problems with brain injury. After my brain injury, I had circadian rhythm problems. It was very specific. My mom says when I was in the hospital around 10 p.m., I'm starting to wake up. By 2 a.m., I'm wide awake, I'm talking, I'm making jokes. I'm really, active in the late night. And then around 8, 9 a.m., I'm falling asleep. And I don't remember that time, but I know that pretty much in my life, I've had to live, around 5 p.m., I feel the most awake. And if it was up to me, I would just go to bed around 2 or 3 a.m. every day. But, you can't. And I've been fighting this, just feeling awake in the later hours and feeling very tired when I wake up. This talk hit me like a brick wall, not because of the circadian rhythm issues. I already know about that, but rather Dr. Jerrod Brown gets into all these other factors that happen basically at night. It's when our bad habits come out, our coping mechanisms, our ways that we do things that are not really healthy. And it's hard to realize that that's something that you're doing because of the brain injury, because of the stress, because of the sleep problems, but it's only making matters worse for the brain injury problem. So it's, adding fuel to the fire or driving the bus, as Jerrod says. I spoke to several people who had attended this talk, and they said they had the same reaction. It's a harsh reality to know that your brain injury problems are causing these sleep issues, plus the other things that we are doing makes it worse. And Jerrod explains it well. This information is essential for people to recognize so they can work to improve and try to make healthier decisions so that they can sleep better. And I know for me, I can say that since this recording, I've been trying to work on my habits. I've been trying to work on my sleep. I've been trying to work on the issues that otherwise are making my sleep much worse. And it's hard to do, but I am working on it. Anyway, thanks. So, Jerry, why don't you take it away? And if anyone has any questions, please this is open for discussion. So, thank you, Jerry.
Yeah, you bet. Thanks, Dan, for having me back. How you doing, everyone? Thanks for being part of this. So this is part two of a two-part series we did, and the first part was kind of on basic overview of sleep disturbances among folks with brain injuries. I encourage you to check that out as well. I think you have a link to that, Dan, and stuff. But we'll just go deeper in the weeds today. Obviously, we're going to focus on circadian rhythm misalignment. There'll be plenty of different tips, strategies, solutions we'll talk about today. Here's my email address. Reach out anytime. I have done tons of work in the area of brain injuries and tons of work in the area of sleep disturbances from a variety of different angles. If you've never heard me present before for Dan's group, here's a copy of my brief professional biography. I have a PhD in psychology. I have four separate master's degrees. I'm working on my fifth master's right now. I should be done the end of this summer if everything goes as planned in applied clinical nutrition. I do a lot of consultation work with different groups around the country, many trainings, quite a bit of publishing. I'm a professor. I teach lots of different courses on a variety of topics: forensic psychology, human services, trauma related classes. I own a forensic training institute. We've done numerous trainings on traumatic brain injuries through a forensic criminal justice lens and a number of other different topics. These are my main areas of focus when I do consultation work. I consult on clinical cases, forensic cases. I've consulted with individual professionals, families, government groups, all kinds of different things. These are some of my certifications, and I do hold a certification as a sleep health coach. I have certifications in a variety of like health and wellness topics. My most recent certification is in lifestyle medicine. There are six different pillars of lifestyle medicine. I love lifestyle medicine because it incorporates nutrition and exercise and sleep and a number of other topics into the equation. And these are my graduate professional certificates. One of my graduate certificates is in traumatic brain injury. I have quite a bit of certificates in different things related to like neuropsychology, neuroscience, and a variety of other topics that have helped me get to where I'm at today with the topic of sleep and circadian rhythm. So when we get into the topic of circadian rhythm, what in the heavens does this mean? So let's just break it down, make it very, very simple. When you study circadian rhythms, you want to be aware of the field of study called chronobiology. That would be something I would definitely be aware of if you want to take your knowledge to the next level. When we study circadian rhythms, think of it as it's approximately, it's not going to be 100%, a 24-hour cycle that really all living beings have in them, humans, plants, animals, and so on. And when it's working properly, it has significant implications for brain and body health. We'll talk about a lot of these things. Interestingly, the Latin word for circadian is really defined as around the day. So the Latin word for circadian is around the day. So we're looking at kind of that 1 day cycle. When you study circadian rhythms, you want to be aware of the topic of suprachiasmatic nucleus. It's a big word. Basically, what that is, it's the master clock in our brain that is located in the hypothalamus, and it processes light signals from our optic nerve, and it plays a huge role in the regulation of all kinds of things, including hormones, neurotransmitters, and the list goes on and on and on. A very high percentage of people that have sustained a brain injury are going to have circadian rhythm misalignment, and it depends on the severity of the brain injury, the location of the brain that's been injured, and if the injury happened to certain parts of the brain that are related to that sleep wake cycle, absolutely that person's going to have more nighttime awakenings, probably more daytime sleepiness, and the list goes on. In the first training we did, we covered sleep disturbances in general. If we had all day, we could go in the weeds with this. There's many, many sleep disorders out there. I think there's at least 90 documented, recognized sleep disorders that are out there now on the books, not just for traumatic brain injuries. But if those of you that study the DSM-5, there's a whole section in there related to sleep wake disturbances. I would encourage you to look at that chapter. In that chapter, you're going to find insomnia, narcolepsy, non-rapid eye movement, restless leg syndrome, and a number of other disorders. By no means am I saying those all relate to traumatic brain injury, but if you look at the traumatic brain injury literature, insomnia is going to be very common. Elevated levels of parasomnias are going to be more common. Sleep apnea and sleep disordered breathing are going to be very, very common. Why is that the case? Well, we could have a couple things going on. Unfortunately, what happens if the person who had a brain injury also broke their nose or broke their jaw? And that can contribute to more breathing related problems. A million things to think about here. So, the circadian system, when it's working properly, we typically go to bed at night and we get up in the morning. We'll talk about why that's not always as simple as that. Heart rate variability plays a huge role in this system. Blood pressure. Anybody that has high blood pressure, low blood pressure, by no means am I saying it's related to circadian rhythm misalignment, but it should be one avenue to investigate. And hormones. Why do you want to care about hormones? I did not coin this. I don't remember where I saw this, but there's an article I read that the researcher called hormones our body's Wi-Fi. Hormones are huge. If our hormones are off, impacts our sleep, our mood, our energy, our gut, all kinds of different things going on.
What you said about the suprachiasmatic nucleus and the hypothalamus, I think is really important, especially towards thinking about these, what's on this list here. What do you know about the nature of the circuitry of the of that brain region?
Not at a deep molecular level, but definitely it is the heart of what we're talking about.
Yeah,
And
yeah.
there is some evidence to support the fact as well that a brain injury, depending on again the location, can adversely impact melatonin receptors, which melatonin also relates to that area. So in the research literature, and I'm not giving any medical advice today, please talk to your healthcare provider, but some evidence supports the fact that maybe melatonin supplementation could be helpful in some cases. However, you'll find other research that says, well, maybe it's not so helpful. Every person is different. We're all wired differently. We all have different biochemical processes going on, different genetic factors. And then if you throw a traumatic brain injury into this equation, it gets even more complicated. So, yes, Dan, that suprachiasmatic nucleus is a very interesting topic. When you Google this, if people want to go deeper in the weeds, just Google the master clock, our internal master clock. And I'm going to talk about what are some strategies that we can use that are very practical and common sense that may help this master clock work a little bit better. But again, some of the research with interventions, unfortunately, and I'll give a whole caveat here, hasn't factored in the brain injury component. Some research has, but a lot of these interventions are not factoring in the brain injury component, which can be tricky. Go ahead, Dan.
Well, that's super important because that's the only reason I brought it up because there's a brain injured part to this story that if you can narrow it down or think about a circuit, a brain region that underlies it, and then the idea that that is injured physically, not working, not functioning, that's just a huge part. I always need to bring up the brain part of the brain injury, basically.
I do have some slides and some studies that are brain injury specific here interventions too. And again, it's not as simple as that. I've consulted on cases where the client has had one brain injury. I've consulted on cases where someone has had numerous brain injuries over and over and over and over again because of domestic violence. And again, every brain injury is different. Every person is different. There are pre-brain injury factors we need to consider. And then what did the person do after the brain injury? Did they do everything by the book, by what their doctors told them to do? Or was it somebody that had a brain injury and just kind of ignored medical advice and went back to work right away, pushed themselves too hard, didn't have a lot of family support? So I'm a big fan of individualized approaches. Even though we want to look at what the general literature says, we still want to individualize to every person. So other things here, we talked about a lot of these already, but what are the processes that are controlled or have influence by our circadian rhythms? Again, body temperature regulation issues, our metabolism. So maybe somebody's trying to lose weight. They're having a really hard time losing weight. Could their circadian rhythms be off as well? Another thing I'll say about that, if you're trying to lose weight and you can't, look at your gut microbiome. Have definitely work with a provider who understands the gut brain axis. That can be a huge factor. The timing of our meals has a lot to do with this. I'm going to talk about chrononutrition today. I love that field. What happens is somebody is eating their largest meal of the day right before bedtime. That's another whole can of worms we'll talk about in a few minutes. So, how does this relate specifically to traumatic brain injury? So, when we think about post traumatic brain injury sleep wake disturbances, what we need to be aware of is that a very high percentage of people brain injuries are going to be dealing with sleep disturbances. And if that person doesn't get the sleep under control, on top of the brain injury, recovery is a little more tricky. It could increase anxiety, depression. And what happens if the person also has co-occurring post-traumatic stress disorder going on, or maybe even just trauma-related symptoms, which then can drive the bus with more cognitive impairments following the brain injury, which could be more executive function impairments, more problems with metacognition, thinking about thinking, knowing about knowing, Maybe it's more problems with self-control, impulse control issues, working memory, cognitive flexibility. The list goes on. And then if you're not working with providers who understand all these moving parts, the research says it can delay recovery and it can impact normal life, which is basically adaptive functioning. And if you understand adaptive functioning, look at the DSM-5. It talks about practical skills, conceptual skills, and social skills. Those can all be impacted. When we think about sleep-wake disturbances specific to traumatic brain injury, we need to be aware of excessive daytime sleepiness. And this could be also for somebody who thinks they're sleeping the whole night and they think they're getting a good night's sleep, but they still wake up every single day exhausted. If that's the case, red flag indicator, go talk to your doctor, maybe get a sleep study. There could be a whole can of worms going on. Topic of hypersomnia needs to be aware of, and insomnia. We all know what insomnia is. Everybody experiences it probably on some level at some point. But insomnia at its core is basically difficulty falling asleep and difficulty staying asleep. Other things you want to consider, this is specific to brain injuries and circadian rhythm misalignment. I'll send my slides to Dan. I know he always sends them out to folks. At the bottom of each of my slides is my full citation. I try to include empirical based research on almost every single slide I talk about, so you know this is coming directly from peer reviewed journals. Occasionally, I'll talk about just my own observations. Blood pressure dysregulation can be impacted when we're talking about TBI and co occurring circadian rhythm misalignment. If you see at the top here that altered homeostatic mechanisms, basically fancy word of saying there's more imbalance going on in our brain and body. Could be blood sugar dysregulation. Our hormones are off the charts, too low, too high. Our gut could be off. All of these things can throw off our mood, our energy, our brain, and really get in the way of recovery from a brain injury. We all know this, but it's a good reminder as well that folks who have sustained a traumatic brain injury are at greater risk of multiple comorbidities. Not everyone with a brain injury is going to be dealing with this, but this is what the research says. The person may have more autonomic nervous system dysfunction. They may have dysfunction related to her cardiovascular system, our renal system, kidney functioning, just the way in which our circulatory system works. It can have a cascade effect on our immune system. There's a whole line of research literature now on traumatic brain injuries and gut-brain axis dysfunction and gut dysbiosis, which is an imbalance in our gut. So our gastrointestinal system may not work properly. And the list goes on. It gets very complicated. But we need to know this if we're going to tackle topic of brain injury from a holistic and integrative approach. Chronotype. All right, so back to circadian rhythm. So when we think about chronotype, my chronotype's probably, I'm an early morning person. I get up early in the morning. My wife's chronotype, she likes to stay up late at night. We're all different. We're all wired differently. Everybody is different. The research says it's pretty evenly distributed. There's a good chunk of folks that have the early morning chronotypes. There's a good chunk of people that have the late chronotypes, so they're more likely to be night owls and stay up later. And then there's a combination where people can have kind of both going on. It's tough to know. Everyone's different. I know plenty of people that stay up late at night and they do quite well during the day. But if you look at the general research, and again, I don't want to worry anybody if you're an evening chronotype, but some research points to the fact that if someone has that evening proneness chronotype where they're more likely to stay up late into the evening and sleep longer in the day, they have worse outcomes throughout the lifespan. Why might that be the case? Well, they could be late night eaters. By looking at the screen late into the evening, you're throwing off your melatonin and you're jacking up your cortisol in some cases. Shift work comes to mind when we're talking about this. So some people that work the overnight shift, that can be a little tricky. but research points to the fact that that evening chronotype more likely to have depression, anxiety. It may play a role in suicidality in some cases, a very interesting topic to look into. It could play a role in increasing caffeine, nicotine, and alcohol intake, to name a few. There's a lot more to this than we have time to go into, but there's some really interesting research that looks at this. Other things to consider when we're talking about that late evening chronotype. And Dan, maybe you can weigh on this too, but there are plenty of instances where someone prior to the brain injury had that morning kind of proneness where they got up and got going early in the day. After a brain injury, it shifted. And now they're up all night sleeping during the day and they're not getting that natural sunlight in the morning. That can be tricky. Any thoughts on that, Dan, just from your opinion, expert opinion?
Yeah, all the changes that you're describing here are all it's like just a cumulative effect, like knots of issues that integrate and then lead to these problems. And I know I was a night person and I became even more, and I have to fight it every single day. All that list of bad habits that you develop in the night, also that rings a big bell. I don't know how to fight it. It's like I have to fight that night person every night. Yeah, anyone else have any thoughts?
Yeah, I can.
Oh, yes.
I mean, I always before injury, I was an athlete. I got up at 4:30, 5 o'clock, relished the time of the day where it was really silent and dark, and did my meditation and yoga, and then went out for my 5 mile run. That's the way I greeted the day. And then of course, I was in bed by 9:30, and got a good solid night's sleep. And then fast forward to accident 10 years ago, very disrupted sleep for a good 2, 3 years into 4 years, sleeping deeply, but waking up exhausted. And, in the last probably 4 to 5 years, I mean, I added supplementation. I'm on my own, so I don't really have support. So I'm juggling a bit, or trying to, or have been. And, so then my sleep wake cycle is I keep planning in my preconditioned behaviors to get up at 4:30, 5 o'clock and get my day started, and I'm still in bed at 8 o'clock, 9:30, and I have to go really slow, because if I try to push my envelope, I'll just crash. But it all depends. It's very concerning for me to be in this type of circadian cycle. It doesn't feel right, and I'm just frustrated to not get to the cycle I was in before, because I felt the benefits. That's just my 2 cents.
Thank you for sharing that. I really appreciate that. And when we get to the interventions, feel free to weigh in, and anyone else, what's worked for you personally? Maybe there's some other things that aren't in the research literature that you just want to share with folks that could be helpful. We're all here to learn and grow together.
I focus on the problems because otherwise they're not talked about. That early morning inability to function, I have that, and I've spoken to many, many people about that. I think as it's a 24-hour cycle, and right after we wake up, it's like the things don't work, and anxiety is at its highest. And I've heard other people talk about those problems.
We all know this. Why are we talking about this today? Because this topic has significant implications for human health from head to toe, not just for brain injuries. The more and more I study human health and chronic illnesses and diseases and impairments, I'm leaning toward the fact that this is at the top of the list in terms of a topic that we need to be aware of and to treat and to get better, because it impacts everything in the human body. So circadian rhythm misalignments can happen for a variety of things. Again, today, focus on brain injuries. But what are some other factors that can impact this? Shift work, without a doubt. If somebody is doing shift work, that's difficult on the human body. Pregnancy, if someone's pregnant, that contributes to circadian rhythm misalignment, the research says, in a lot of levels. Jet lag, time zone changes, certain medications can impact this. If somebody just has poor sleep hygiene practices where they just don't take care of their sleep health, they don't have a good routine every night, Even changes in routines can throw this off. Our bodies are rhythmic. The more routine we can get, the better off we are. If someone changes their routine abruptly, that's tough on the human body, and it's even tougher on someone that has a brain injury in a lot of cases. People that have chronic medical health conditions, mental health challenges can make this worse. Menopause makes this worse, and just the aging process as we get older, this is impacted. Those are just some of the things talked about in the literature. And there's multiple different kinds of circadian rhythm disorders that are out there you'll find in the research literature. We don't have time to get into all of them, but jet lag or rapid time zone change syndrome is something you'll find in the literature. There's a disorder called shift work sleep disorder, delayed sleep phase syndrome. If you watch commercials, you'll probably see different commercials about, like, here's some medications for some of these. Advanced sleep phase syndrome, non 24-hour sleep wake disorder, irregular sleep wake rhythm disorder. So there's so many different disorders out there, and that's a big reason why it's imperative to talk to your healthcare provider and work with a sleep specialist, because somebody could have a full-blown circadian rhythm disorder, or they may just be dealing with circadian rhythm misalignment. This is a threat to brain health as well, the research says. If we have chronic disruptions in our circadian rhythms, impacts brain health. Of course, it throws off homeostasis in the whole body. Other things just to be aware of, and again, this isn't to alarm us, but I think education is powerful. This is for all human beings, regardless of what's going on. If somebody is dealing with these factors here, these are big, big threats to human health. Sedentary behaviors. If someone is laying around all the time and never getting any movement, research says that's just as bad as smoking cigarettes. Excessive alcohol consumption, not good. Cigarettes, absolutely not good. Do a lot of work in the area of cigarettes. Obesity, malnutrition, not getting proper sleep, eating between meals. That gets a little more tricky, but this is more going to be related to someone has the meals, but in between, are you snacking on all kinds of junk food and sugar sweetened beverages and donuts and fast food, all that kind of stuff? And breakfast skipping, that's a whole nother can of worms. There's a ton of research that shows people that consistently skip breakfast every single day are much more likely to have problematic outcomes. Why am I studying this topic? Here's another reason. This is not an all-encompassing list, but these are a good list of the disorders that are connected to circadian rhythm misalignment. If any of you are working in drug or alcohol treatment programs, if you don't learn about this topic, you are missing a key component to intervention. If any of you are working in the field of mental health, if any of you work in pain management, there's a whole line of research literature that talks about how to combat pain, get better sleep. It's not going to cure it, but it's a big, big factor to take into account. If you work with folks with neurodegenerative disorders, Alzheimer's, dementia, Parkinson's, very important topic to be aware of. Metabolic dysregulation, metabolic syndrome. Most people are not metabolic healthy in the United States. Type 2 diabetes, high cholesterol, a lot of weight around the gut, those kind of things. HPA axis dysregulation, that's the hypothalamus. Pituitary adrenal axis, another big topic you absolutely need to be aware of when we're studying these topics. This is actually related to skin related problems, asthma, the list goes on. So this is just one slide of many why I think it's so important for us to know about this topic. Mood dysregulation. If somebody has a lot of mood instability problems, that could be extreme highs and lows, tons of anxiety, tons of depression. A lot of times there's a million layers to this, but circadian rhythm misalignment could be a big driver. I do a lot of consulting on cases where the client has a lot of mood instability problems. These are the main ones that come up in the research literature. This has come from hundreds of studies that I've gone through over the years. Too much to go through today, but I put a list together. Again, Dan will send you the slides. You'll have these exact slides. But what are the triggers for mood instability? Well, not eating well, not sleeping. What about dehydration? I just consulted on a case last week where the client ended up in the hospital because she drinks soda all day long and never touches water. There's a whole nother can of worms we don't think about as well. What about noise annoyance? There's a whole line of research literature related to noise pollution and noise annoyance. If you're laying in your bedroom at night and you live right across the street from a busy freeway or a train tracks or an airport or whatever it is, or you live in a crowded household and there's people making lots of noises, that's noise annoyance. That is a threat to human health and it's not good for sleep. What about the adverse childhood experiences research? I teach tons of classes related to trauma, and I do a lot of work in the area of trauma and PTSD and complex developmental trauma. The ACEs research is basically research that shows the more childhood trauma someone has without proper intervention, supports, and services, they're much more likely to grow up and have health problems. There's more research coming out showing children that have had multiple traumas in childhood, it's imperative to screen for head injuries as well, because did that trauma relate to that child getting hit in the head or thrown down on the ground or domestic violence or child abuse? How does early childhood trauma factor into this? It's linked to more gut dysbiosis, so more gut problems. It drives the bus with inflammation in the body. Most disorders are related to chronic low-grade inflammation, including depression. Oxidative stress on high levels is not good. Mitochondrial dysfunction is related. If you're studying fatigue, learn about mitochondrial dysfunction. It throws off our circadian rhythms. There's a whole line of literature on telomere biology. That's a fascinating area. We could do talks on every one of these topics, Dan, but these are good search terms if you want to really understand what is going on a molecular, biochemical, and neuropsychiatric level. Learn about these topics here. Post-traumatic chronodisruption. So if the head injury resulted in that client also being diagnosed with post-traumatic stress disorder, this just makes everything a little bit worse. So working with a trauma specialist is going to be very, very important as well. I'll stop there for a moment before we get into some screening red flag indicator things to be aware of.
One thing that we did discuss in the last talk, and I think it's worth bringing up here, is also, the nature of there's a fatigue that comes with brain injury and exhaustion and overwhelm. I see it as directly connected to the brain injured problems, the invisible problems people have, plus the overall exhaustion of having to function because your brain is always working, and when it's injured and not working correctly. Anyway, I think that fatigue overlaps with this, but is different. Is different because that one is due to the brain injury, and it will lead to further problems with this. And I don't know if anyone has any thoughts about that.
We don't want to push ourselves too far. We want to take more breaks. You're your own expert. Don't overdo it. I hear from a lot of clients, don't multitask. Focus on one task at a time. Finding professionals who understand brain injury and probably not throwing rapid fire questions out at the individual because of the processing speed weaknesses that can overwhelm the client as well. And that can lead to more fatigue and then people shut down.
And finding people that understand is a critical problem. I see it. I don't know many. That's a regular issue with people being advised or assessed by someone who doesn't understand these things. I mean, that's a huge problem. That's why we're doing this. And
Yeah, it's tricky. And I don't know why more people don't know about this because there's literally thousands of studies, journal articles that have been out there for decades after decades. So it's out there, but it's just not taught a lot in certain school programs, which it needs to be.
yes, that's a whole topic we can get into too.
All right, we'll just keep it rocking and rolling. So common sense, but I wanted to show you this is from a 2025 article that was just published this year. Again, working with anybody, but let's just look for folks with TBI who have sleep-wake disturbances. Early screening for this, starting to identify red flag indicators, and then individualizing the goal plan, the intervention plan to that client's unique experiences, their strengths, their limitations. Very, very, very important. This is in general for all of us. It's just another fantastic article that comes out of the chrononutrition literature, but it's just a good reminder. A lot of people don't live healthy lives in general in the United States. And we all have problems with this, but if someone is engaging in any of these behaviors, do whatever you can. Maybe start nudging yourself or working with people and moving in a direction of health. If you're eating unhealthy foods, maybe you talk to a registered dietitian, a licensed nutritionist. It can't hurt anything. There's tons of literature on nutrition and brain injuries. If you sit all the time, move more, but obviously talk to your doctor. You don't want to overdo it, but light walking, could that be helpful? Sure, I think so. I'll show you some stuff on walking in a little bit. Irregular eating times. I'll talk about chrononutrition in a minute. Skipping meals. I'm not talking about intermittent fasting, time restricted eating, but if someone just skips meals all the time, what happens? Blood sugar dysregulation, probably some hypoglycemia going on. What does our brain need for fuel? Glucose. Where do we get glucose from? The foods we eat. If we're skipping meals, our brain doesn't have enough fuel, so our thinking is not as good. We're more moody. If you deal with a lot of psychological distress, no shame in working with a counselor. These are different things that really any provider, in my opinion, should just start looking at, asking questions, be aware of with the people they serve. Another study, just different things, a 2024 study that just talks about some of the lifestyle practices that are associated with increased risk of chronic diseases in general.
Okay, you mentioned intermittent fasting, and I've been
Yeah.
doing it for a couple of years. I really like it. Any objection to intermittent fasting? I was the 16-hour fast.
Is that intermittent fasting? Yeah, it's on the spec. Probably like that's probably more time restricted eating. I love that literature, but what I will say is if it's a person with a brain injury, talk to your doctor because it's not as simple as that because the brain needs calories, it needs fuel, and for someone that has a brain injury, it could be a little more complicated. So working with a licensed or registered dietitian, nutritionist, functional medicine provider,
Okay,
naturopath would
I,
be
I
very
don't do
helpful.
that. I don't do that. I don't work with health providers, but I stop eating like 4 in the afternoon and I just start the next day at 8 in the morning, and it doesn't seem like any kind of hazard. And I'm an early morning person. So,
If you look at the general literature on that, take brain injury out of there. Again, I'm not giving any medical advice today, but the literature is very good about that. Stopping your eating earlier in the evening. Why is that good? Well, it gives your gut time to slow down. It helps your blood sugar levels and stuff like that. And I love the research on that, but it does get a little more complicated when we're talking about chronic health conditions and different kinds of neurocognitive impairment. So, great question. Dan, maybe we can do one on nutrition in the future and I could tackle what all the research findings say about like time restricted eating and all of those things specific to brain injury. It's complicated, no doubt about it.
Yeah, that's a good topic. Thanks, Ruth.
Light pollution. We know about air pollution and noise pollution, but what about light pollution? Getting a lot of artificial lights in the evening, not good. And that can come from a variety of sources, including being on your gadget, watching TV. This is all common sense stuff. We all know it, but just some things to be aware of. Other health compromising behaviors, another study from 2023. Again, every study's a little different. Not taking care of one's dental health, big factor. We all know smoking cigarettes, obviously not good at all. Too much social media usage, excessive screen time exposure can be a threat to human health. If someone's dealing with chronic stress and you're not managing your stress in general, that can contribute to more anger control problems. Cognitive distortions, what is that? Could be rumination, catastrophizing, all or nothing thinking. What's this decreased inhibition? Inhibition is a fancy word of, just think of it as your brain's parking brake. If you have good inhibition, you have a good parking brake. You can pause, reflect, think through things. You're not as impulsive. Inhibition is an executive function. People with brain injuries a lot of times have more disinhibition, which equals more impulse control problems, self-control deficits. Other things to consider, remember the chronotype? We talked about the morning and the evening type. Social jet lag, definitely be aware of. What is social jet lag? If somebody does everything by the book Monday through Friday, they go to bed at a good time, they get up, they get off work at 4 or 5 o'clock on Friday, partying begins. They're out partying, drinking, up all night, having a lot of fun on the weekends. Come Monday morning, their whole system is completely out of whack again. That's social jet lag. Again, shift work, something to be aware of. Psychiatric, mental health issues, and just disruptions in our eating practices. What we eat has a lot to do with this. How much we eat, when we exercise, how much we exercise, and what's going on with our own individual health status. I'll go deeper in the weeds with this in a minute. Light exposure impacts this. So, in an ideal world, you go to bed at night, you get up at a good time in the morning, and you get natural sunlight. What happens if someone's sleeping in and they're not getting any natural sunlight in the morning? That throws off their circadian rhythms. If you go back to the COVID literature, I did a lot of work on sleep disorders during the era of COVID. There was a sleep disorder in the COVID literature that was called COVID somnia. It was just basically insomnia on steroids. And what the research said during the heart of COVID and during the lockdowns, people were up later at night watching the news and getting all worked up and stressed out, rightfully so. They were sleeping in more in the morning and they missed that natural window of sunlight. They were eating more foods, snacking on things that were full of sugar and salt, putting on more weight. The stress was up, circadian rhythm misalignment went way up. Why do we want to care about this topic again? What happens if someone's dealing with critical illness? They're in the emergency room, they're in a long care facility for whatever reason it is. If you're working with critically ill patients, you're in one of these facilities, lots of beeping is going on, nurses are coming in, checking on you, waking you up. What happens if it was an organ replacement kind of therapy protocol? You're getting a lot of noise. Maybe there's feeding tubes. Maybe the person's dealing with immobility because they broke a bunch of bones and they're in a wheelchair. Huge factor to consider when we're talking about working with folks in these kind of care facilities. There's a lot of screening tools out there. Again, I'm not advocating for the use of these unless you have like proper training and stuff, but just be aware. I mean, you can read this, Google this, but this is not an all-encompassing list, but there are different screening tools out there. Professionals say, well, I don't really have an expertise in this. I don't know what to do. Well, listen to this podcast, read the literature, learn about these tools, find out if the tool is a good fit for your setting. There are different screening tools out there. Screening tools are not assessment. It just opens up the door to more referral to maybe a qualified specialist.
The statement you made of like, I don't, when therapist or clinician says, I don't really know how to deal with this, it's the same for us. And like a lot of what you're describing scares me because I'm like, oh, okay, I got a lot of those, and I see the knot of the problems. And I've been trying to work on my sleep, for years, but it has a lot of these brain injury drivers plus the other consequences. So I think maybe I'm jumping ahead, but I feel like thinking about it and trying to assess it and trying to take it apart because it's like a big knot that you have to take apart to try to improve. So I think they can do that, and we also have to do that, or it's beneficial for us to try to do that for ourselves.
Dan, this is overwhelming probably to hear all of this stuff. And I get that comment sometimes when I give talks like this. There's so much you're throwing at me. I have to throw all this at you guys, in my opinion, to know what's out there. This is recorded. That is why I'm throwing so much at you. Go back and listen to it a few times. Chunk it out. Nobody is going to be able to tackle all of these things, but the more you understand these terms, you're in a better position to advocate for yourself, find providers who understand these things, and this can help piece together this complex puzzle of recovery, in my opinion. And Dan, you and I have talked about alexithymia several times during our phone calls and emails.
Yeah.
Half of people with brain injuries or more have alexithymia.
Yeah.
Alexithymia is a driver for all kinds of problematic things, including sleep issues, depression. Alexithymia is emotional blindness. Google my name and type in alexithymia. You can find a couple articles online, different podcasts I've done. When someone has alexithymia, they're going to have a hard time understanding emotions, labeling emotions, regulating emotions. If that's the case, all their negative emotionality a lot of times goes into their body, which then causes more physical complaints, including sleep issues. This is a really important topic to be aware of too, and a good reminder to work with a therapist, a counselor, a coach, someone you trust to get those emotions out. Reduce screen time exposure. That's the most practical thing I can say with this slide is get off your screen in the evening if possible. Easier said than done. I get it if someone's in school or working or all kind, but the more you can get off that screen in the evening. Some research says get off an hour before bed. Some research says get off 2 hours before bed. The more you can get off that screen at night, the better off you're going to be, I think. And why do you want to be aware of excessive screen time exposure in general? It's been linked with more anxiety, depression, hyperactivity, drives up the bus with stress. Very important topic to be aware of. Again, I'm not giving nutritional advice today. I'm just saying it might be helpful to work with a registered dietitian, licensed nutritionist. If somebody eats the Western diet way of eating day in and day out, what is that? Lots of red meat, processed food, sugars, dyes, this is fast food. If you eat this way once in a while here and there, probably no big deal. But if someone eats this way day in and day out, more gut problems, more metabolic dysfunction, more brain issues, it's a threat to human health. Chrononutrition. Okay, so what is chrononutrition? It's a branch of nutritional science. It's a branch of chronobiology. Remember, we talked about chronobiology a little bit in the beginning. Understanding our circadian rhythms, understanding our chronotype. Basically, it relates to these things here. Nighttime eating, problematic. It does talk about time restricted eating, intermittent fasting, breakfast eating. In my experience, most registered dietitians, licensed nutritionists, probably, I don't know this with fact, but I haven't come across any that have an expertise or at least market themselves as experts in chrononutrition, but it's out there in the literature. There's more and more studies coming out on this. It's a fascinating area of study. I'll show you a few more things about this in a minute. But when we think about what are some unhealthy chrononutrition behaviors that talk to your doctor about, be aware. Consistent breakfast skipping, long eating windows. What could that be? Someone goes to the buffet and sits there for hours and just eats that whole time. They may not eat a ton that whole time, but they're just consistently eating. That just spikes our blood sugar levels. Irregular eating patterns, consistent eating, probably better. Eating right before bedtime, the research says, not probably good. Nighttime eating, so someone wakes up in the middle of the night and start eating really not so good things. And then unhealthy food choices, ultra processed foods, sugar sweetened beverages, candies, things like that. What about caffeine consumption? I've done some more work in this area as well. Excessive caffeine exposure is also a threat to human health, including energy drinks. I've consulted on enough cases where a lot of the clients consume a lot of these beverages, and it's really not good. How's COVID-19 factor into this? So again, the lockdowns, the stress with COVID, definitely studies have looked at the long-term effects of COVID-19 within the context of circadian rhythm and chrononutrition. Obstructive sleep apnea is way more common than we realize. Full disclosure, I have sleep apnea. I weigh normal weight. I exercise regularly. I eat healthy. I do everything by the book. I was shocked to learn I have sleep apnea. I went to my dentist a few years ago and they said, "Did you suck your thumb as a kid?" I said, "Yes." It looks like the way in which my mouth formed caused obstruction with breathing. They said, "You should go get tested for sleep apnea." So I did. Sure enough, I have sleep apnea. I didn't even think about it. Sleep apnea can happen for a variety of reasons. Sleep apnea is more common in folks with brain injuries. The gut and our circadian rhythms are intimately connected. The gut microbiota is part of the gut-brain axis. This is one of the most important topics to be aware of. If you Google my name and type in the gut-brain axis, you can find an article I wrote. It's a short 5-minute read. It's very practical. If your gut is off, look at the circadian rhythms and vice versa. What are factors that can impact our gut? There's emerging research in the TBI literature as well. Target the gut, get it better. This can help. Dan, I think you and I briefly talked about maybe doing a talk later this year on psychogastroenterology and why it's important for the TBI world to be aware of that.
Yeah.
Basically, psychogastroenterology is mental health providers not only targeting mental health, but also the gut. I would also call upon traumatic brain injury advocates and educators to learn about that field as well. There's a million things that can adversely impact the gut. What we do with our lives, what we eat, our circadian rhythms. Night shift work can throw this off. In case any of you do work the night shift, you have loved ones that work the night shift, this is a really neat article that was published in 2019 where they cited this study from 2006 that talked about 9 principles of shift work scheduling and different things that maybe shift work people need to be aware of that could help minimize maybe some of the adverse effects on their body. Before we go into the tip strategy solutions section, Dan, anything you want to share? Anybody's got any comments?
If no one has any questions, I just want to comment on what you said about you're listing so many things, but for each person I look at it, there's like specifics that fit that person's issues, and then it's an overall umbrella of what are sleep problems, or there's a big topic, but for each person there's issues that are very relevant to them. That's why I see this structure and this long description is necessary as well. Anyone have any questions?
Yeah, I have a question.
Yeah.
I'm an older person, I'm 86. And I guess my question is aging and insomnia. And I find that when the cat wakes me up or something wakes me up after sleeping for 4 hours, I can't go back to sleep, but it's not bad. I get very enthusiastic and I want to read and I want to plan things. So when I wake up, I'm feeling like I really want to start the day, but it's only after 4 hours, and eventually after a couple of hours of doing things, I go back to sleep. So I guess the question regards, is this part of aging? Is it part of the brain injury? Is it a combination? Is it that bad?
It could be a combination of all of those factors, and sleep is one of the most complicated topics out there. So when people wake up, it could trigger them with hormones. It could be something else triggering that. And that is a huge reason why, if someone has these kinds of things going on, there's no harm, I think, in talking to your doctor, getting a sleep study, and also on top of that, maybe getting a full panel of blood work because for sleep, it's influenced by all kinds of things, including our hormones and nutrient deficiencies and melatonin levels and cortisol. And there's all kinds of things out there. It gets very complicated. For some people, they're okay with that and they function okay. But in my opinion, what's number one to health? Sleep. If we can build an intervention plan around getting good sleep, that's the key, in my opinion. I'll show you some other stuff in a minute. See if you think this answers your question in deeper detail. If not, come off mic if you can and just keep asking. We'll go deeper in the weeds.
Can I also bring up 2 questions that came up at the end of the last talk when you weren't here when we pre-recorded? One was how to deal with brain injury, sleep issues, and having narcolepsy previous to the brain injury. although I don't know what her problems were specifically. But if you could comment on that. And the other one was someone basically can't sleep because of the shunt they put in their head and the noise from it and how to deal with that.
Yeah, not the easy thing. I think the first intervention for the narcolepsy question would be go to the medical doctor, talk to the sleep specialist, maybe get a reevaluation. So if someone dealt with this prior to the brain injury, you have that baseline data. After the brain injury, imperative to get another sleep study to see what has changed. Without that data, it's hard to make a informed, personalized intervention plan. For narcolepsy, that gets a little more tricky. So working with providers who have that expertise, and in some cases, maybe medications is an option on top of a lifestyle approach where maybe lifestyle medicine would be a good approach. Working hand in hand with medical doctors, but also kind of those other holistic approaches can be very, very helpful. And then the shunt question, I'm not saying there's not literature out there on that, but all the sleep studies I have read, I don't know of any I've come across when it talks about best practices in how to deal with that. That gets very, very tricky. And I know there's probably not a lot of medical health providers that have that expertise, but if you can piece that together and work with that healthcare provider, that might be very, very helpful. But on top of that, cognitive behavioral therapy for insomnia would be worth looking into. That is a gold standard intervention for insomnia. Looking at white noise machines comes to mind, earplugs, distraction techniques, but again, everybody's different. Sometimes a white noise machine could trigger them because of sensory processing issues. It has to be individualized. Everyone is so different. Tackling those comorbidities as well, I think if you're running into dead ends and your sleep isn't improving, what do we do about it? Well, let's look at all the comorbidities. If we know the client isn't eating well, that's important to target. If we know the client is dealing with social loneliness, that could be a very important target. If we know that person is on their screen right up until bedtime, or they're drinking tons of energy drinks, or they smoke cigarettes, the more of those things we can target, the better off the human body will be. And hopefully, by default, our system starts working better and maybe we start getting a better night's sleep. Again, we can do all the things by the book as well, and that person may still be dealing with sleep issues. It gets very, very tricky, no doubt about it. So again, individualize our approach. Not one provider can tackle all of these, working with a multidisciplinary team. This is specific from the TBI literature, another great article that was just published in 2025. Again, if you look at the bottom of my slides, full citations, cognitive behavioral therapy, definitely worth looking into. Sleep hygiene practices, again, looking at your bedtime routine. Light therapy has been talked about in this literature. And then again, talking to your doctor, certain medications could be very, very helpful. Other things, bright light therapy, I'm not advocating for that because there are some research findings that show that bright light therapy could be tricky for some folks, especially if they have like co-occurring bipolar disorder. It could trigger mania. So talk to your healthcare provider. Schedule dim lighting in the evening. So in the evening, start to dim that lighting. Why do you want to dim the lighting? Well, that might help with melatonin production, which could help you get into deeper sleep. Blue blocking glasses. So if you are on your screen late into the evening, maybe get some blue blocking glasses. That might help reduce that. Melatonin supplementation might be helpful for some and others not so much. Again, this is a decision you'd have to make with your healthcare provider. Sleep hygiene practices, again, are really focused around what do we do when we get up in the morning? Look at your whole day. And then as you get close to bedtime, what are the practices you do that help you get a good night's sleep? And what are the things you do that don't help? One example would be, maybe someone loves their coffee. Are you having a ton of coffee in the afternoon? Maybe shift that to try to wrap up with your caffeine earlier in the day. Again, everything needs to be individualized. If you go online, you can find all kinds of things and tips, strategies, solutions. Here's some basic things that might help reset your circadian rhythm. Start slow, develop a consistent schedule throughout the day. Get up earlier in the morning, easier said than done for a brain injured person. Look at your mealtime behaviors, limit, reduce, or even eliminate all alcohol and caffeine, depending on the individual. Exercise good. Too much exercise for some, not good. Too much exercise right before bed can trigger things. And then look at artificial light exposure too. Try to reduce that. This is something to be aware of. When we have good circadian rhythms, this is from another good article, 2023. People that have better circadian rhythm alignment and they seem to be more active in their exercise patterns. I gave a talk, I don't even know, probably a month ago to a group of attorneys about circadian rhythm misalignment and criminal behavior. And there's actually emerging research on that as well. If you're working in the criminal justice system, another avenue to take a look at it may play a role in reducing aggressive behavior in some cases. So anger management programs, domestic violence programs, learn about this topic. It may be a whole nother intervention to consider. So breakfast consumption, chrononutrition are talked about. Another reason why I think anyone with a brain injury, any human would do well consulting with a licensed nutritionist, registered dietitian. Routine breakfast consumption, a good thing, but it's not as simple as, oh, you have breakfast. What are you having for breakfast? How much are you eating for breakfast? The importance of screening for dietary patterns is supported in the literature related to circadian rhythms. Chrononutrition, again, maybe it's setting up consistent meal times, not overeating right before bed. This is where a qualified professional could really look at the client holistically and kind of maybe develop a nutrition plan that would fall in line with their circadian rhythms. Erratic eating patterns can throw off our circadian rhythms. Irregular energy intake. So maybe someone is just eating tons and tons of food and they're just so full right before bed. That can throw off so many things. Eating again for long periods of time, consuming many, many meals a day that are unhealthy, and then getting up in the middle of the night and eating a lot of unhealthy foods. These can all throw up for circadian rhythms. I do a lot of work on these topics in different presentations. Again, it'd be good to maybe look at a nutrition talk at some point in the future, Dan, if people would find that interesting. But the number one healthy diet in the world, according to research, is the Mediterranean diet. How does this relate to traumatic brain injuries? Well, to me, common sense of someone, any human being that's eating the Mediterranean diet, it's better for their health. This is going to be folks that are not eating fast food and red meat and portion control. You're having lots of fruits and vegetables. Again, I'm not telling you to go do that. What I am suggesting, working with your healthcare provider, the DASH diet, someone's dealing with hypertension, good research on that. Whole plant-based food diet, good. But what about protein and things like that? That's why you need to work with professionals. So it's not as simple as eating a bunch of fruits and vegetables. You might be deficient in protein then and other things. These are some good interventions that I have found to be helpful. I showed you the triggers for mood instability before. These are some good interventions found in the literature if someone's dealing with a lot of mood swings, mood instability issues. But these are just some general strategies to consider. This is a case I consulted on. I am not advocating to go out and exercise and do that from my advice, but this is a case I consulted on. The client had a lot of different things going on in his life, neuropsychiatric issues, cognitive impairments, the list goes on. This particular client, with his group home staff, got into a regular walking routine, obviously got approval from medical providers and things of that nature. This is what this client reported just from walking. Allowed opportunity to get more supportive feedback from staff. It helped the client get a little more silent time to help their brain just process things. It did help the client become more patient. It helped him reduce stress and worry. It actually played a huge role in reducing fatigue. There's some really interesting research out there on walking interventions and walking therapy. If you look at the research on walking in general, easier said than done, especially if we're talking about somebody that has mobility issues, things like that. That can get tricky, of course. Fantastic research on the benefits of walking in general. This is another reason why maybe it's important as part of that multidisciplinary team to have an exercise physiologist, an exercise specialist as part of this. I do have a graduate certificate in exercise prescription. In that fantastic program, I learned a ton. Exercise is medicine, but it gets more tricky when we're talking brain injuries. The benefits of walking are many and varied. These are general practices in the research literature, not necessarily specific to TBI, but these are techniques that can help with improving our sleep, getting more movement, relaxing music, prayer, if appropriate for the individual, meditation, reducing caffeine, especially in the evening. Read a boring book, maybe. Some people that's helpful, some people it's not. Doing some calming walking. A white noise machine can be helpful for some and triggering for others. I do a lot of work in the area of fetal alcohol spectrum disorder, and in that literature, it talks about, you know, they talk about incense, me and like aromatherapy being good in the general literature, but for somebody that has sensory processing issues or olfactory sensitivities, the very nature of smelling incense can be very triggering. So again, another reason why we want to individualize all of this. Take a warm bath or shower before bed. Earplugs could be helpful for some. And everything I'm talking about today, when we talk about interventions as we get ready to wrap up, if you live in an area where there's not a lot of providers, there's plenty of research that shows telehealth, remote-based interventions, telecoaching, telepsychology, whatever you want to call it, can be done remotely by computer, by phone. So finding providers outside your area is a possibility. Here's my email again. Reach out anytime. Glad to help you out and point you in the right direction. If you have questions, I'll stick around now. Thoughts, concerns, anything I said you disagree with, or if there anything you want to add, just share with the group.
Thank you, Jerrod. There's a lot to take in. You used some words, comorbidities, and adaptive functioning. I see it as a knot of comorbidities and adaptive functioning to deal with things and also to improve the brain injury problems. And yeah, sleep is so important. So working on it is better than nothing. And I have also recently adopted walking and just trying to change basic factors to sleep better and take care of myself. I gotta rewatch this. So I think if there's no questions and no ideas, or no further comments, Jerrod, we can set a time to talk and thank you all. And I think we'll call it a day.
Appreciate all of you. Thanks, Dan, for having me back.
Great. Thank you very much. And all right.
I wanted to add for people who have mobility issues, sit in a chair, find music you like, and dance as much as you can from the chair. You know, it's a lot of fun, you know, if you, it's nice to dance, but if you, you know, if it's hard, sit in the chair and dance as much as you can with your legs and your arms. To
Yeah.
Air
music you
yoga
like.
could be helpful, and heated pool therapy. I've known a couple people have done that. That's been helpful too.
Good examples. These are all as I was saying, for the foothold to do some work on any of these is hard. And if you can't walk, you sit. And if you can't do either, you're in the water or yeah, whatever you can find. I'm gonna try to implement that for myself for my problem. So,
Now I have a question.
oh, okay, perfect. Please.
Delayed processing here. It just popped up in my brain because I was thinking about float therapy, the salt tanks to float in. And that was
Oh
very
yeah.
relaxing for me. And one of my challenges around circadian pieces, I mean, this is really pretty impactful. It's a lot of work. And this was, as a former athlete and very balanced, I'll just put it that way, very, very aware of my body. This has been a horrifying experience for 10 years. And for you to point these things out, it's like what I've been experiencing. And again, it's been very horrifying for me to know that my health has been this much affected in so many molecular levels that I haven't had practitioners even have a clue about. So I've been doing a lot of this just solo. But what I want to ask about is the sympathetic system and parasympathetic. Um, so when my body systems began to regulate somewhat parasympathetic at 8 years after the accident because I was in sympathetic overload cortisol pumping for 8 years.
Yep, yep.
So the sympathetic system, I finally went to, well, I forgot about a practitioner that would have been really helpful, and I've seen her for 2 years. So craniosacral therapy that's been hugely helpful. I think that
So
the float tanks were helping my body to recognize, to drop into parasympathetic, to drop into a more natural, relaxed state. And I would imagine that the body needs to be able to regulate to a certain degree to that extent for rest and rhythm to begin to synchronize and identify in these patterns and rhythms that are there's multi levels of them with all of our systems to recognize how to harmonize together. It's the easiest way I can say, but that's all. It just that bubbled up about the sympathetic and parasympathetic.
Kim, thank you. I'm sorry you've had to deal with this, and it's just a great reminder that we need to work with people who are also trauma informed, who are kind and compassionate and understanding and person centered and strengths based and sympathetic, kind of that fight or flight, parasympathetic rest and digest at the basic level. And yes, if someone has that activated sympathetic nervous system right before bed, probably going to be very difficult to get into deep sleep. You know what works for you, everyone. So anytime you can calm that body down and mind in those kind of float tanks, awesome. I think that's, yeah, they're really cool and stuff. I encourage people to look into that a little bit. And Dan, you said walking, that's a great way to activate the parasympathetic nervous system, but it's individualized. What happens if someone's walking and they're walking in a very congested area and lots of noise and people are honking? That is a great way to activate the sympathetic nervous system. So walking in green space or just in nature, just calm things. Maybe listening to music on the surface sounds great, but what happens if someone's listening to music that's just hardcore and screaming and loud? That activates their nervous system. Calming music, rhythm. Our body craves consistency and healthy rhythms as well.
You remind me, I went to an audiologist because I have tinnitus post accident that screams in my ears or in my brain, and I couldn't get to sleep because it just was so loud. If I was so exhausted, I'd fall asleep, but then if I wake up, the tinnitus was so loud, it just was disturbing. I couldn't calm back down with that, and I had a audiologist say, "Well, just pretend it's crickets on a summer night and just go to sleep to that." I'm like, "This dude has no clue." Um, and then it's like, "Well, listen to music," and I'm like, "I'm just adding more aggravation," you know. So I think there's this time for me in the first 5 years post accident where trying to find some slice of a sweet spot in regulation within my systems was challenging.
What seemed to calm that down eventually?
Well, the first 3 to 4 years, I woke up with what I called a TBI hangover. Was just like I mean, I just was aggravated and just really irritated. And then my girlfriend and I, who we did Ironmans and former triathlons and stuff together, she's like, "I think you need to hydrate when you wake up." And I'm like, "Okay." She's like, and then somebody gave me a clue about protein, upping my protein, and then breathing. But my respiratory diaphragm had been locked from the shell shock of the impact. So I wasn't getting vagal tone, at least for the first two years. And it's not a light switch, it's a slow processing kind of a thing. So there's a lot of different factors that I worked on. So 50% of the time when I woke up, she would send me for 2 months straight every morning emojis, a water drop, an egg in a pan, and a balloon to remember to hydrate, protein, and breathe. And so 50% of the time that would take the edge off and I wasn't so aggravated in the morning. So then I started taking magnesium threonate. Was told that about 3.5 years after the accident. So I started taking that at night before I went to bed. It's accumulated over period of time, like years. But now that I'm at year 10, I am getting some better sleep. I can feel it, but it's just, and I had sleep studies. The first one wasn't done correctly, so I had to have another one. And then that guy from pulmonology said, "Well, this is a neurology thing that you don't have sleep apnea, so you just go back to the neurologist." Well, they didn't do anything. So it's just getting bounced around the people that aren't really reading up on what you're doing here, Jerrod, and really paying attention and thinking. It's just really hard. So what has helped me? Time. I do walk in nature. I do try to be in quiet. I live in a very busy street and road, so my environment is not conducive to my body just going, ah. So I have to
Yeah.
take myself away and go in nature.
And I think we might have lost her.
She might have frozen or been lost. And
Eyes,
Well, Kim, if you can hear us,
the rhythmic pieces. So yeah.
we lost you there for a minute, Kim, but you covered a lot of important topics, and the magnesium is a huge topic. I know magnesium well, and I will say about that, most people are deficient in magnesium on some level. And again, another reason why maybe to go get a full panel of blood work. And a lot of times Western medicine doctors aren't good at tests for those things. And a lot of times it has to come from the functional world, which the downside of that is insurance doesn't pay for that stuff usually. So it's very expensive. But if you can get that data and work with someone that maybe can use like precision or personalized nutrition interventions, it'd make a huge difference.
thank you, Kim.
Thank you, Kim.
Yeah, I need to work on that. I have also years of stories to improve my sleep, but I don't want to get into that right now. Needless to say, it's nervous system stuff the doctors don't. So anyway, thank you all, and I think I'll call it a day because it is getting late. So thank you.
Thank you, everyone.
Thank you.
All right,
Thank you, Dan.
bye.
Bye-bye.